Hi, I'm Maddie, and I will be talking about how marijuana can bring significant benefits to health and well-being. Ethan Stewart was a man, he was 40 years old, and he had been diagnosed with severe illnesses early on in his life, including multiple sclerosis, various forms of cancer, and Lyme disease. His doctor said that there wasn't much they can do for him anymore, and he turned to medical marijuana as his new course of treatment. And in March 2016, he stated that when his test showed his cancer on the rise, he began pursuing cannabis, which is a form of marijuana, and he began to feel better, and 2 years later, it became a critical tool in the fight for his life. Currently, he is cancer-free, and he claims that marijuana was a big role in the significance of his recovery. Many people often think marijuana is only used for a high, or that it's only something that is used for the stereotypical negative views, but marijuana is beneficial for chronic illnesses, acts as pain relievers by reducing symptoms, and helps with mental disorders. So marijuana is beneficial to those with chronic illnesses such as epilepsy, Lennox-Gastaut syndrome, and Dravet syndrome. They can be cured, or their seizure reductions can be lowered with marijuana. On June 25th, 2018, the FDA approved a new drug called Epidiolex, and it was composed of marijuana. And a GW pharmaceutical company did an experiment on the new drug, and they stated that during the treatment period, patients taking Epidiolex of 20 milligrams per kilograms a day achieved a median reduction in monthly seizure rates of 42% compared to those who got the placebo, and their reduction rate was only 17%. For Dravet syndrome, the New England Journal of Medicine did an experiment on that, and they gave patients 20 milligrams per kilograms a day, and they, for the ones who got the drug, their seizure reduction rate went from a 12.4 to 5.9, compared to 14.9 to 14.1 with the placebo. Marijuana can also help cancer patients by reducing their tumor sizes and stop their cell growth. The Complutense University of Spain, the researchers did an experiment on mice with human tumors, and they discovered that they shrunk tremendously with THC, which is a form of marijuana. And the California Pacific Medical Center stated that with marijuana, it can slow down the rate of metastasis, and if you don't know what that is, it's when tumors extend from the primary source, so it's an extension of the cancer. And it can stop non-small lung cancer, which is the leading cause of death globally. The use of marijuana can act as pain relievers by reducing symptoms and chronic pain. It helps reduce nausea and vomiting in chemotherapy patients. Cheyenne Shaw was a young woman diagnosed with stage 4 ovarian cancer, and she began taking medical marijuana because the doctor said there wasn't much they can do for her. And she stated that even though I experienced weight loss, exhaustion, hair loss, I never once got sick. And she stated that she was even back in the gym a couple days after her treatment due to medical marijuana. It can also help with neuropathic pain, and that is numbness and weakness in your extremities. There's different components in marijuana, and each contributes to the help of neuropathic pain. Afghan Kush can help with muscle pain and a relaxant. White Widow helps with your sleep. Jack Flash can help with, they act as painkillers for it, and Harlequin and green crack can help with inflammation. Marijuana can also help with mental health illnesses. It reduces anxiety by THC and CBD. Carrie Cutler, she was a psychologist at Washington State University. She did an experiment on anxiety by using an app called Strandprint, which is an app that tracks anxiety patients by their use of medical marijuana. And out of 12,000 of them, they had a reduction in anxiety by 58%. Stress levels can be reduced with marijuana as well with the proper dose. At the University of Illinois Chicago, they took 42 patients, split them into 3 groups, a low dose, a high dose, and a placebo. And the researchers stated that the products that appeared to be the most effective for stress relief had THC content at or above 26.5 and CBD at or above 11%. So overall, as you can see, medical marijuana, any forms of marijuana, can bring significant benefits to your health and to your well-being. It's not only used for the stereotypical views or like, what teenagers use it for, but it can be used to help your body heal. And so again, marijuana can bring significant benefits to to your body, your health, and your well-being. It can help with chronic illnesses, act as pain relievers by reducing symptoms and chronic pain. It can help with your mental illness, but while doing so, you have to be careful and take the right dosage amount for the best significant benefit. Thank you.
Okay, Maddy, the proposition's clearly identified. It does seem like it's got two parts to it, health and well-being. Maybe there's a way that we could condense that, but the contents are nicely previewed. You suggested that there are three particular benefits, and you mentioned what they are at the beginning of the speech. The first point was signposted pretty well when you were talking about chronic illness, and you start with an example, and then you've got some other information. It does appear that there's probably less dispute on this one since it has been approved by the FDA for use for these purposes, and so the notion that there is some authoritative proof on this, I think, is pretty strong on that. On the other issues, maybe a little bit less so, although you do a good job presenting the research on those particular points. You mentioned a number of studies, the publications of those studies in authoritative journals. I thought that was pretty solid. Maybe a little bit iffy on the mice research, but the application there is understandable. I know there's a transition to the pain relief issue, but it needs to be a little bit clearer. I could pick it out based on the evidence that's being presented. That was a little bit also thinner. It's very dependent on examples in that situation. There's one place where there's a list of all kinds of different kinds of marijuana, and you make a claim for each of those as having some benefit. I have no source citation for information that you're presenting there, so that's a little bit problematic. And then the mental illness issue, I think, gets short shrift. It appears very quickly near the end. It's a little underdeveloped, but you do have some good information on stress and anxiety reduction, and I thought that was solid. I'm not sure how applicable it is to the other things that you're talking about at the end. Again, the research that you present seems to sound like it's pretty authoritative. Probably we could use a little bit more explanation of what's happening there. You do a generally nice job speaking to the audience as well. Thank you.